We're trying to use this occasion to encourage all the residents in the NWT to learn more about men's cancers and on the importance of a healthy lifestyle, on getting screened to protect your health. And we all know that men are usually the hard group to get for preventative care. They tend to, as a group, I'm not talking about specific individuals, but as a group they tend to wait longer and to resist, and often they need a lot of prodding from their spouse or friends to actually get screened. So we're trying to use this opportunity to highlight some of those issues. Cancer is the second leading cause of death among men in the Northwest Territories, very close behind cardiovascular disease. So it's really it's an important, about a quarter of our deaths are related to cancer. It remains important to point out that the most important known risk factor for developing cancer remains smoking. So it's certainly for 85% of the lung cancers are related to smoking, but many people don't always think that or realize that there's a whole bunch of other cancers that are associated with smoking, such as nose and throat and stomach and gallbladder and kidneys and urinary tract, along the urinary tract, the bladder, and in women, breast cancer. So although it's still worldwide, there's still the most important factors that we can contribute to reducing overall cancer rates. But going back to men, the three most important cancers in the NWT that are diagnosed in men are prostate, number 1, colorectal cancer, number 2, and lung cancer, the third most frequently diagnosed. However, lung cancers account for 13% of new diagnoses. They represent 26% of cancer deaths, so they're the biggest group of cancer deaths, and that's usually because lung cancer tends to be found late. There's no screening tools for it, and most of the time they're not curable, so people do die, and that's what explains the fact that although it's 13% of diagnosed cancers, it's the most important cause of death from cancer. 20% of cancer deaths in men are related to colorectal cancer and 10% to prostate. Colorectal cancer is 1.6 times higher in the NWT amongst male than in the rest of Canada. And our IRIS rates are actually in Dene men, so that's an important group for us that we wish to target with regard to colorectal cancer. Routine screening is an important way to reduce your risk of dying from cancer, because the earlier cancer is diagnosed, the simpler the treatment, the higher likelihood it will be successful, and there's usually more options as well. But preventative measures to help reduce the risk of colorectal cancer and other cancers usually also involve maintaining a healthy lifestyle. Overall, the incidence of prostate cancer amongst NWT males is 24% lower than in the rest of Canada. But most of our lower rates are actually in the Aboriginal men, so most of our non-Aboriginal men have similar rates to the rest of Canada. A man's risk of prostate cancer increases after the age of 50. Most often, men diagnosed with prostate cancer are over the age of 65. Men who have a close relative, such as a father or a brother who have experienced prostate cancer, particularly those that have occurred at an earlier age, have a greater likelihood of developing prostate cancer themselves. So there's a strong family history link to prostate cancer. So discussing your family history with your healthcare provider is an important part of the things that you need to do, so that you can assess your risk and also the types of things that you might need to do in terms of annual checkup. Choosing to live a healthy lifestyle and taking an active role in preventative health care will go a long way to improve your well-being and reduce your risk of dying from cancer. And as a department, we aim to enhance our focus on chronic disease prevention, screening, including for cancer. Individuals, families, and communities are encouraged to make healthy choices. We're also working on a project right now that's called Working on Wellness in Strategic Populations. We've nicknamed it WOW, but this aims to reduce chronic disease and improve wellness through the delivery of workplace wellness programs, particularly in the male-dominated work sites, and my deputy, Dr. Candola, is very actively involved in this project. And we're partnering with a number of large employers, especially at the mines, because they have the right target audience for us. And we also recognize the need for more information and support resources to address men's and women's cancer concerns. And we have much to learn from those in our communities who have experienced cancer. Talking openly about cancer is an important first step towards improving the experience of our residents.